These are going to be the rotational PIVMs, PAVIMs. Those acronyms are still going to confuse me, but that's fine.
Okay. I'll have to think of something else.
Create a new acronym for me. Thank you, Mark.
All right. Okay, so we're just gonna do a straight old, plain old rotational PIVM, right? We're not gonna, although in a second, we're gonna kind of wind things up a little bit, so this is kind of in a neutral position. So the one thing you have to watch, do you mind if I pull your shirt up?
Yeah.
Is position of the spine, right? So you wanna try to be as consistent with every person you do this on as possible. So Carolyn's kind of flexed in this position. She's kind of side bent a little bit, which is related to her posture. So you have to kind of take that in consideration when you do the PIVM. Some people will be side bent the other way, whatever. So you want to try to find as neutral a position as you can. So
Can you put a pillow underneath them if they have really wide hips too?
absolutely.
That's what I
Yep.
usually do.
Yep.
Not that she has really wide hips, but
So I always like, the one thing is to get people close to you. A lot of times I see people way up here and they're gonna hurt their backs. Okay. So we're gonna try to find kind of more of a neutral spine position, so that looks a little better to me. So in order to kind of get over, so Carolyn kind of automatically goes into a bit of a side bent position. So this hand is just gonna kind of rock back just a little bit. Offsetting the feet is important. So it doesn't really matter where, but just so that they're not one on top of the other. So it allows a little bit more mobility. So if we're going to do a PIVM, you can do it from cephalad to caudal, or caudal to, I did it backwards. Cephalad to caudal or caudal to cephalad, just depends on how you want to do that. I'm going to do it cephalad to caudal. And again, I for now, I'm just kind of generically kind of finding a spot, trying to find an interface and a little bit of rotation. Like that.
Are you looking for a transverse process then? In the
Right
gutter?
now, I'm just kind of on spinous processes. And you know, that last time we were talking about getting in the gutter? Yeah. Always like to try to find that, because I think palpation of muscle is such an incredible important tool for us. And either it's going to be hyper or hypo, right? So they're either going to have high tone or low tone. Multifidus is really what we're looking for. Oftentimes it's going to be decreased multifidus, so inhibited multifidus. But oftentimes as you come down, that's kind of the level that you want to find, is where are those palpable changes? And that's really when we do a manipulation where you're going to kind of hone in for that manipulation. Yeah.
Where it's inhibited or
Where you find the palpable change usually.
Okay.
Yeah.
like a denser tissue?
Could be either one.
denser or less dense.
Right.
Okay.
A
there.
change.
Yeah.
It's almost like it just don't feel right.
I find
Right.
with the rotation with smaller hands that using like all 8 fingers, like along the gutter or whatever, makes a bigger difference, because if you're kind of like, I think we learned it in school, kind of like 2 fingers
Yeah.
on either side, it just doesn't feel like you have enough grip. And that like top arm, also as someone with like not as much force, looping underneath her top arm really gives you that like mechanical advantage to actually rotate them and not just get them like flopping over.
Yeah, the other thing that might be helpful back there is to have them, can I borrow that? Do that, right? So they're really holding, and then this arm actually does a lot of
Because
the
people will
work.
tend to just like open up, and that top arm will just flop right
Flop,
over if
yeah,
you
that's
get
a good
them
point.
over enough, and it's then
Yep.
you're like resetting and you're in the middle of like doing manipulation. They don't know what you're doing, or like a mobilization, and they don't know what you're doing, so they're just like, "Oh, you want me to be way over here?" And it's like, "No, I don't." So that probably would be really good.
Yeah, you want to try to keep the segments kind of perpendicular to the table. So if you're like way out here, or we'll talk about this, for the manipulation sometimes you do bring people this way, but for the most part I want to start things so you're perpendicular to the table like that. You okay? Yeah, okay. And you can do a little bit of a counter rotation. So this hand's on the inside of the spine is processed. This hand is kind of more in the gutta. And this table actually is a little too high for me, but that's okay.
Do you want me to lower it?
Yeah, that's okay. I'm going to lower it here in a second. Yeah. Okay,
The other thing
easy peasy.
that I'll mention, because I do this a lot, a pillow that size underneath someone is really helpful, so you don't have to also add a distraction.
In here.
Yep.
Yeah.
Because if
Thanks,
not, like
Carolyn.
Mark did in the beginning, it looks so easy, but like on someone who's not Carolyn's size, it's very hard to also get a distraction. Like I don't know if it's called a distraction, but an inferior glide there of the pelvis so that you're in neutral. It's really hard to like do that and then also feel what you're doing, and like be like hunched over someone. So sometimes just adding that pillow to like neutral spine, and then you can just work on rotation, and it's a lot less going on.
Yeah, right. So this hand is side bending, just to kind of get to that correct position. And then when we do a manipulation, it's very important to kind of to create the stiffness and the barrier to the manipulation. You're going to want to do a bit of side bending there, or like Hannah was saying, you can externally put that with a pillow, something like that.
Or a rolled up towel.
So you're talking about a pillow, just for the video's sake, here.
Yep.
Okay, great. Thank you.
Yep.
And it's typically for people that have wider hips than they do a waist.
Right.
That's going to be when that really comes in handy. Men, sometimes it's the opposite. Sometimes you almost want something underneath their hips because they have wider shoulders than they do hips. So they're getting the opposite. You're getting a side bend the opposite way.
Yeah.
So just trying to correct that side bend. I like to do it externally because it's too much going on. I'm like sweating by the end of it.
Well, and if you're going to do this as a treatment technique and be there for a while, it's probably a good idea to do that. Right?
Why in neutral versus at end range and doing graded oscillations
Yeah.
there?
You mean from a treatment standpoint? Yeah. So this is an evaluative technique. So we're just going to kind of start neutral, but absolutely, right? So if you want to get to end range, we'll just talk about it now. So if I want to now take, let's say I'm going to just pick a joint, 3-4 into extension on the right. So I want to bring 3 into extension. What can I do potentially to bring that segment into extension? This is a semi-complicated question, I guess, but if you think about it.
Rotation to the left.
Yes, correct. So rotation to the left. You could also kind of bias. So I'm actually going to pull on Carolyn and bring her into a side bend in this direction. So she's side bending this way, extending into that side. Right? So that's one. This is where the manipulation comes in. And then if we wanted to do a little bit of extension, I take that same joint, I'm going to kind of extend a little bit. So I'm finding that joint moving into extension. Straighten your bottom leg out just a smidge. Good. So I want to go that way with L3. Is that the one I used? Yeah, L3. Yeah, and that way with L4. So, go ahead and bring your hand back here. Is this okay? Yeah, okay. So it's here, and then this side is going to be, I'm going to overdo it here. So now if I want to manipulate it into extension, I can just step back with my left foot, kind of roll here, and then the manipulation is like that. Yeah, does that make sense? Kind of? Yeah. Right? So if we wanted flexion, you could do just the opposite. I gotta get you back to kind of there. There. Good. All right, so now I want to flex that same segment. I'm going to bring the arm this way, kind of into a little bit of flexion. Put that there somewhere.
So wait, just to be clear, we're moving away from rotation, or at least as the topic.
Yeah,
We're
okay.
okay.
Yeah.
All right.
Here.
It's a rotation video.
That's exactly what it was. I was like, all right, that's done now.
Well, no, because wait.
Video.
Here's the rotation,
Yeah.
people. At the segment, right. You saying I'm going on a tangent again?
Only a little bit.
Right. So you're right. And then here's the rotation for the manipulation. That's the rotation. But so I've flexed, and now the manipulation is in this position.
So you come to the decision if you want to do a flexion bias or an extension bias based off of their.
Segment again. All right. Ooh, bend your knees just a smidge. So a little bit of kind of flexion up to that segment. If I want to do another little bit of flexion down to that segment. Be flexible there. All right. And that's there. That's here. Now, so I flexed up to it, down to it. That L3-4 is neutral, right? Because I've tried not to move into that. And now when I manipulate, I get a bit of stiffness here from the flexion, a stiffness here, so I'm just kind of taking up the tissue slack. And then the rotation, just a plain old kind of rotary manipulation in that neutral position. All right? Make sense? Kind of? Yeah, yeah. A couple things about manipulation. Well, do we want to talk anything about the rotational pivot? Kind of easy peasy. Yeah. A couple things about manipulation. One is it helps to kind of bring a little stiffness to those barriers. So if you're just going to do a plain old kind of chiropractic, I'm going to lay somebody down in this position, they call it the $1 million roll, and just have at it. You're not really kind of getting it to the segment that you want. So if you kind of stiffen things up with those kind of these maneuvers that we were talking about, so a flexion-based maneuver here, and then a flexion-based maneuver here. So it's in theory a little bit more specific, right? And then a couple things that'll help. This table is just a little too darn high, even for me. Okay, a couple things that'll help, kind of, especially if you're a little on the smaller side, is get this stiffness through here. You want to make sure that you're up over the top of the patient. And I'm actually going to roll Carolyn towards me, trying to keep everything the same here. So I'm kind of log rolling her a little bit. I glue that foot there. All right, so now I can get a little bit more on top. So I get a little bit more of my body weight to create that thrust. And then I'm going to step behind, kind of bend my legs a little bit. So the people that are really good at manipulating, they can make a quick movement straight down towards the table. Is this okay? Yeah. Do you mind if I manipulate here? Yeah. Okay. So right, I create a little bit of stiffness, kind of rolled Carolyn towards me, find that barrier, and then it's, go ahead and take a deep breath, let it all the way out. And then it's really just kind of drop straight down towards the table like this. What's that?
I didn't for this break. All the way out yet.
Okay, we'll try it. Go for it.
Okay.
Movement, both from an upper and a lower section, right? So I can either do a manipulation through the pelvis this way, right? So I set everything up and I go this way, okay, which is kind of a neutral position, right? Or I can come more in this direction, step back with my left foot, so now I'm in this plane, and I'm exaggerating a little bit, but now I can do a side bend towards and manipulate into extension base.
Make sure I
Right? Does that make sense? So the movement is like that. Or I can come this way, and now the thrust is in this position. So still same position here, but now when I kind of thrust, I'm coming that way. If you see the pelvis kind of side bending,
So your pressure is
basically it's
straight
to the
down.
left, but I'm trying to
Yeah,
do
you
that
don't, you're not
movement.
trying to rotate
Okay?
when you mobilize.
And then from the upper part,
How is the
with this hand,
this one an extension?
yeah, this way, it's caudal cephalad. So I'm taking the lower segment into a
You're pushing
relative-
towards me.
No, this way. So it's like,
Bottom towards.
so this segment is going that way. So and this segment is going that way.
Okay,
which
now
is
I get it.
extension of, let's do L3 on L4.
Okay, I
And then
see
do
it
it the
now.
other way.
Yeah. And then the other
Oh,
way
okay.
is going to be like that, which is flexion.
Got it.
Now that makes sense.
That
now.
makes
Thank
sense.
you.
I needed the
That
Yes.
works?
hands.
Yeah, cool. So then up here, right, same deal. I can do plain old rotation, which is a pull this way. I can do an extension movement, which is now bringing the arm kind of this way and pulling towards me. So now Carolyn is side bending like that, because I'm pulling this shoulder that way. Or I can come here and come more into a flexion position. And well, you flex very well.
I think it
She
might.
actually flexes a little bit more than I like, so I'd probably want to kind of come in and just guide this a little bit more so this stays relatively perpendicular to the table. Instead of if I do that, then she's way flexed off the table.
She will let me distract her right
The trust.
Right.
So much trust.
All right,
So
so
when
that
you-
makes sense, kind of?
When you manipulate, are you pulling the pelvis for, or is it like
It's
I-
really straight down.
Okay.
So it's, you know, here, and a lot of people actually just end up like really dropping straight. So it's really, it's a drop straight down. Because
Okay.
you've got everything set here,
So you shouldn't have to pull.
so you
or
shouldn't
do
have to
anything.
pull. So you've already done all that movement,
Yeah.
and now it's, and the more you get up on the person, so the more you're here, the better. You can't do it from back here.
Well, sure.
Right? Because you're dropping and your arms would do it. But here, it's almost pelvis to pelvis, and it's kind of straight down towards the table like that.
So as I say, is you're forced through your like forearms more than anything, so it's down but into
Yeah.
their body
Yep,
rotation.
that's right. Yep. You know, maybe a little kind of this at the segment, but it's really, that's the force, is the downward force.
In the manipulation class I took, they were talking about like the seal position because you want to be like the seal at SeaWorld when you're ready because you want the chest up and like be ready to go rather
Yeah.
than like
Yeah.
rounding forward. a
Yeah,
bit.
that's great. That's a great key.
And they also
See, I'm
recommend
big, so I
practicing, like,
force it.
Yeah.
Like, has anyone seen Ralph Ortiz? You guys know Ralph Ortiz? He is a bear. He is huge. And he manipulates his patients, and I've seen him do it a couple times. And I'm like, Jesus, it's like an assault. But so he can get away with that, and I can because I'm just bigger. Whereas, right, all these tips are fantastic. That you want your head up, you want to make sure that you're kind of pelvis to pelvis. You're dropping straight down. You're kind of using your body force to do that. Rolling the person towards you is very important because it allows you to get more kind of momentum. It's really tough to do it here. It's a little easier to be here like that. So now I'm letting gravity help me a little bit with this because Carolyn is forward into that rotation. But realize it's not just I'm stabilizing here and I'm rotating. That's not what we want. We want kind of the whole deal rotates forward. And then it's like that.
Which is how you can go straight down, right? Because if the pelvis is
Yeah.
stacked, you're just pushing pressure through the SI joint, right?
Yeah.
Like you actually have to be tilted for your straight down pressure to give you a rotational thing.
Yeah, right. Totally.
In the past, we've discussed how it's very difficult to do segmented
See, Meg?
lumbar manips,
Mm-hmm.
which is why like some of the stuff gets a little convoluted in a way. So
So what I just said to Meg and Carolyn is how I've really changed how I talk about manipulation, right? Because the research is pretty clear that
You're good.
is we're going to side bend away and rotate towards so you can get the segments of the spine to kind of stiffen up, right? So here's the kind of the side bend piece. So here's the side bend away, okay, and then we're going to rotate towards. And this one's a little tricky when you rotate towards. Get your elbows together, please. Good. This hand, I'm just going to kind of slide down. So if you're not careful when you side bend, they end up rotating out of it, and it's really damn near impossible to get the stiffness you need. So this right hand just kind of slides under Carolyn's shoulder to kind of keep that rotation.
That's okay, it's good.
Yeah, keep that rotation, right? So you get to this point, this hand is now going to come in here. I'm going to make a fist, and I'm gonna plant my fist in the table, and I'm gonna put my weight through that. So now I've got this locked in. I'll make this quick because I know this isn't comfortable. Then this hand is taking the pelvis straight down towards the table. Good. Take a deep breath, Caroline. Good. Let it out. You guys were talking about sinking in, so you sink in one more time, and then we're gonna do it. So deep breath. Good. Let it all the way out. Good. You're just gonna come to the end. I'm not gonna really rip this one, but then at the end.
Oh,
Right.
see, sound effects. You got it.
Yeah.
I heard it. I heard it too.
And if you do that one right, they will manipulate from their sacroiliac joint all the way to their head, and then they feel better. This, it's an SI manipulation, really, is what it is, but we use it in that CPR because it's a great lumbar manipulation too.
Your patient was also super knowledgeable and crossed
Right, she
her own
crossed her
too,
legs.
so that was good.
So you don't have to have that, but yeah, that can be very, very helpful. It's all about creating stiffness. So you want to create stiffness. Manipulation is all about creating stiffness above and below, and then keeping the segment that you want to manipulate in a neutral position. So that's why we do all these funky kind of movements, is to get everything kind of stiff to that one segment. And now when I manipulate, all that force is, in theory, in that one segment. So when we kind of go over neck manipulation, if you guys want to do that, that's really what it's all about. Not today, but at some point, is just making sure you're getting that side bend rotation opposite is what you can use. And then that segment that you want should be kind of mobile. Because if you go through it, as Meg was talking about bony